Good afternoon, everybody, and welcome back to the Cannapreneur Partners Canna News Break. And we've been documenting for, I don't know, the better part of maybe about a year now of the medicinal effects of cannabis, the medicinal benefits of it. And while you can't technically study the plant yet in the U.S. because it's illegal on a federal level, and the DAA won't allow for any testing, and the FDA won't allow testing on it, except for extreme limited circumstances at the current time. That's going to change hopefully soon, but right now that's the way it is. So we have as universities doing a lot of these studies where they're examining people's reactions to cannabis for various ailments and various conditions in the human body. We have another one today out of Harvard, in McLean Hospital in Boston. So again, this is Harvard. We've done studies in the past from Johns Hopkins, some studies in the past from the University of Miami, et cetera, et cetera, et cetera. So we're talking about, quality institutions. This isn't some, random study by some group that put together a website and decided they're going to do a quote-unquote study on cannabis. 37 patients enrolled in a study for various chronic pain conditions such as neuropathy, joint pain, and arthritis. Patients had either never used cannabis or sustained from using it for a minimum of 1 year prior to the research. And the study revealed that those who use medical cannabis daily for 6 months experienced notable advancements in their overall health status, less pain, less anxiety, better sleep, and mood. What's more, the patient's opioids usage dropped by 13 and 23% on average after 3 and 6 months of medical treatment, retrospectively. So think about it. We got a study that substituted cannabis for opioids, or was initially given in conjunction with. The patients all reported improvement in pain and anxiety, better mood, better sleep, and 13 to 23% less opioids being consumed. So again, it's another example of people substituting a plant for a dangerous, addictive opioid to treat symptoms like pain and sleep and whatever. The naturalistic study of medical cannabis patients with chronic pain provides preliminary evidence that real-world medical cannabis treatment may be a viable alternative or adjunctive treatment for at least some individuals with chronic pain, wrote lead author Stacy Gruber, Ph.D., Associate Professor of Psychiatry at Harvard Medical School. As results also revealed that individual cannabinoids appear to exert unique effects on pain and comorbid symptoms, more research is needed to potentially optimize the cannabinoid-based treatments for pain. It's amazing. So this plant is full of cannabinoids. Our body has an endocannabinoid system that regulates all of its functions, from mood, from sleep, from pain management, anxiety, et cetera, et cetera, et cetera. It goes right down the line. The cannabis interacts with the human body in a way that alleviates stressors on those areas and improves those areas. Interestingly, we have found that patients aim to achieve symptom alleviation without experiencing the intoxicating effects of THC. Therefore, it is likely that patients are able to achieve adequate pain relief using lower doses of THC over time than initially utilized. So what she's saying is that rather than smoking a whole joint, people can kind of microdose throughout the day, not enough THC to have any kind of negative effect on you as far as your cognitive abilities, but because of the cannabinoids in the cannabis, you still do get the underlying relief in the symptoms that you're taking it for. It's a fascinating study, and again, we're talking Harvard Medical School here. We're not talking, Joe's Research Lab in Toledo, Ohio. No offense to those of you in Toledo. But this is another study that's saying real-world effects of cannabis, alleviating the scourge of opioids on our society right now. We have an epidemic in the U.S. on opioids. We do. This plant helps people get off it. I mean, it's a no-brainer. Let's legalize it now. Let's legalize it federally and stop this dog and pony show. So we'll be back with more, and thanks for listening.